Good afternoon. This is Roxana Horta, and I'm here to present assessment of knowledge, attitudes, and beliefs of sexual transmitted diseases and HIV among Hispanic young men, a descriptive correlational study. First of all, I need to explain why this problem is important. Hispanics are the fastest growing demographic group in the United States and the largest, youngest ethnic minority group. In 2012, the CDC reported the Hispanics account for about 17% of the population. However, 21% of them are diagnosed with HIV. That actually is even more problematic for Hispanic men, which carry about 87% of these diagnoses, approximately 8,500 cases. Hispanic men also have an increased incidence and prevalence of other sexual transmitted diseases, such as syphilis and gonorrhea. The problem is that Hispanic men, especially those in the age range of 15 to 24 years, acculturated and unacculturated, report substantial sexual risk-taking behavior. Having multiple sex partners, using condoms inconsistently during intercourse, and having tendency to combine alcohol and other drugs with their sexual experience are common in Hispanic males. Traditional views of the machismo behavior, multiple sex partners, and protected sex are part of the culture, the Hispanic culture, and actually is not strange in Hispanic families. Among Hispanic men, low levels of STD knowledge has been found, and also low perceived risk. The CDC report the Hispanic men have low levels of HIV testing, and Hispanic males are either unaware or disagree with routine HIV testing or have delay in testing until late in the course of HIV. The majority of studies of HIV and STD among Hispanic have primarily focused on newly immigrated Hispanic males, Hispanic women, and Hispanic men who have sex with men. Very few studies have been done in Hispanic males, and the reason why this study is important because usually Hispanic males, partners are usually Hispanic women, so this epidemic can exponentially grow up in the community. The purpose of this study, of this descriptive correlational study, was to describe knowledge, attitudes, and belief of STDs and HIV among young Hispanic men and to explore the relationship between age, HIV, and STD knowledge among Hispanic males in two South Florida college campuses. The research questions are four, and the reason why we developed this question is because we want to know the level of knowledge of HIV and STD among Hispanic men attending college. What are the sexual behaviors, HIV beliefs, HIV testing, patterns and sources of HIV education among Hispanic men? Is there a significant relationship between Hispanic men and knowledge of HIV, HIV knowledge and STDs? And is there a significant relationship between age and knowledge of HIV, STDs among Hispanic men? To do this, the design and the methods, the study was part of a larger study throughout the minority serving institution HIV and Substance Abuse Prevention Initiative, Substance Abuse and Mental Health Service Administration, SAMHSA. Hispanic men attending college were recruited from two sites, a minority serving state university and a minority serving urban state college in South Florida. The sample of individuals eligible for the study were identified themselves as Hispanics, identified themselves as males, were 18 years or older, enrolled as a student, and able to speak and write and read English. IRB approval of both sides was obtained. After providing verbal consent, the participants completed a self-administered survey. The measures used in this study consisted of the 18 community health survey, demographics, sexual risk behavior, beliefs about HIV and HPV, Carey and Schroeder 2002 brief HIV knowledge test, HIV KQ18, which show an internal consistency reliabilities range from 0.75 to 89. In this study, the alpha was 0.83. And this second measure was Jaworski and Carey 2007 Sexually Transmitted Disease Knowledge Questionnaire, STD KQ, which show an internal consistency of an alpha of 0.86. In this study, the alpha was 0.9. So both of our measures show are reliable and they have acceptable alpha levels. Statistical analysis was done using the SPSS version 22. Descriptive analysis of demographic variables, including means and standard deviations, were done. Items from the HIV KQ18 and the STD KQ questionnaires were summed to calculate total scores for each measure, each with means and standard deviations. Alphas were also calculated for each of the questionnaires. A Pearson product moment correlation coefficient for variable relationships was also done. A median and interquartile range calculated for Likert star questions. Results. The sample consisted of 179 participants between the ages of 18 and 64 years with a mean age of 24. Most of the participants were under 25, about 78% of the sample. The majority of the sample was partnered. However, they report their status as single, 67%. 60% of the respondents identified themselves as straight. 20% of the sample identified themselves as gay or homosexual. 8.9 identified themselves as bisexual, and 9.5 as other, and which included undecided, lesbian, or other. 17%, about 31 individuals in the sample reported a history of HIV or STD. Further results show that 48%, almost half of the sample, report not having exclusive partners. Most men reported sex with women, about 65.4%. In the same sample, in the same multiple female sexual partners was also shown by 18% of men, and 30% of men report having unprotected vaginal sex. 25, a quarter of the sample, also report having sex with men and having unprotected anal sex in the last 3 months. About 25% of the men report that. 3% of the men who report sex with men has multiple male sexual partners, and 47.5% of the men reported never or rarely insisted that their partners use condoms. More than half of the men never asked their partner to discuss their HIV status. Finally, 8% of the men in the sample report exchanging sex for money, and 16.3% reports having sex with prostitutes. We'll continue with the results, and this is about about HIV. And 57% of the men report not knowing how to protect themselves from HIV infection. And however, although they report not knowing this, 69% of the men do not feel that they need to be tested for HIV. And in the discussion, I'm going to tell you what is this behavior is showing the sample. 7 out of 10 men in the sample reported a negative HIV status. However, more than half of the men reported never been tested or tested more than a year ago. So it's more than 50% of the men in reality, they don't know the HIV status. Among the men who reported negative HIV status, 29% reported never been tested for HIV. Results of the brief HIV knowledge shows that the men sample were knowledgeable about prevention of HIV. Correct responses to the 18 items range from 58.7% to 84%. The mean number of correct responses for this questionnaire was about 13.2 at a possible score of 18. On the E10 level, the mean range from 0.59 to 84, as we showed before, and the scale mean 13.21 with a standard deviation of 4.04. And it also showed a good discrimination with adding total correlation range from 0.28 to 0.62. In the sexually transmitted disease knowledge questionnaire, overall, the men show poor knowledge of STDs and HIV in this questionnaire related to the transmission modes and the proper use of condoms. The mean number of correct responses for the STD KQ knowledge was about 14, almost less, 50%, and a possible score of 27. On an 18 level, the mean range from 0.59 to 84. And the scale mean was 14.43 with a standard deviation of 7.21. So the E10 correlation ranged from 0.32 to 67, indicating good discrimination. And our correlation results, a strong positive association between knowledge of HIV with a mean of 13.21, standard deviation of 4.04, and knowledge of STD, both at scales, they show a strong correlation, and we can reject the null hypothesis and say the higher levels of HIV knowledge are associated with higher levels of STD knowledge. Regarding the age, moderate positive relationship between age and HIV knowledge scores were found, and also, it was found a weak positive relationship between age and STD total score. So this has a lot of implications since was hypothesized that with age, men will have more knowledge about that, about STD and HIV. Discussion, and just to give you some highlights about the study, about half of the men in the sample engaged in various risky sexual practices, increasing the chances of becoming HIV or STD infected. And this is consistent with other studies. Many men tended to have multiple sex partners and to use condoms inconsistently with anal and unprotected vaginal sex. More than half of the men in the sample do not believe that using condom may decrease the risk of HIV. Moderate knowledge of HIV and poor knowledge of STD was also found. Something that is not here in the slide that I would like to share with you is that the study sought to investigate the knowledge of the men, but it was also findings suggest that these men are engaging in sexual risky behaviors. Many of these men report not asking their partners for the HIV status, although these men have in the average of 2 years of education. They're also not a really favorable response to condom use, and some of the literature suggests that perhaps it has to do with Hispanic men using condoms with the main partner, and when they have other partners, they don't tend to use condoms. It's also have to do with social and cultural issues in the community, and which men is seen as strong, and usually men have multiple sexual partners, and it's not seen as something that is risky. Plus, the misconceptions in HIV, several misconceptions about symptoms, modes of transmission were found, and also a lot of lack of knowledge, especially about STD, herpes, gonorrhea, chlamydia, and hepatitis B were found among these men. So it was a deficit of knowledge about those issues, and which might explain why Hispanic men are at a higher risk for HIV and STDs in the United States. There are several limitations in this study, and one of the limitations was the use of a convenient sample and the way we process the data, the data. Study results may be more descriptive of this particular group of Hispanic men, And it might be difficult to do a generalization of findings since this was done specifically to college campuses, and we don't take in account Hispanic men who do not attend college and other Hispanic men who perhaps has already finished college. So there's a limitation there. There are several implications for practice. We need to have more aggressive approaches that are needed to disseminate information on HIV and STDs. Understanding the reasons why some men in this sample have never been tested may provide some insights. And a community response that will include key stakeholders, health departments, school, churches, community centers. However, all these efforts should be population specific so that it addresses particular socioeconomic cultural factors in the Hispanic community. And one thing that I didn't talk about it was that usually Hispanic men get their HIV and STD information from the family. And our study suggests that less than 50% of men have ever got information from the healthcare providers, which is very surprising, and it should really open our eyes to see how can we, as healthcare providers, being able to talk about things it might not be talked about with your doctor or your nurse practitioner. Conclusions, this study aimed to get an insight on the knowledge of HIV and STD among Hispanic males. However, almost half of the participants in this study were involved in some kind of sexual risky behavior, multiple sex partners, apathetic views over condom use, low HIV testing, not knowing HIV status and their sexual partners, poor knowledge of STD transmission, and myth about HIV continue to prevail among these men. Hispanic men are increased risk for HIV due to these factors. There is an urgent need to make concerted effort to reach these men with programs that address their specific cultural beliefs that intensifies their risk-taking behavior. Thank you very much. And this work is, I'm going to submit this work to Hispanic Healthcare International, a publication of the National Association of Hispanic Nurses. And it's been, thank you very much. It's been a pleasure to present this work. Thank you.